Hello, my name is Gloria Napoles, and I am currently a dental hygiene student here at UT Health Science Center in San Antonio. Today I will be sharing with you some great knowledge concerning brushing and flossing. And this is to provide you with a healthy smile and remove plaque. So let's begin. So the Bass method is the most effective method for brushing and is also recommended for adults. First, you want to begin by grasping the toothbrush handle in the palm of your hand with your thumb against the shank. Make sure that you are near enough to the head of the brush so that you have effective control. You want to place the side of the filaments, these are considered filaments, at a 45 angle between the gingival and the tooth. You want to press slightly so that the filament tips enter the gingival pockets and embrasures and also cover the gingival margin, which is just like this. And please do not bend with pressure. You want to begin with a vibrate jiggle motion with the toothbrush back and forth with very short strokes. Be careful not to disengage the bristles from the gingiva, which is the gum. You can also count 10 vibration motions while brushing on 2 to 3 teeth per group. 2 to 3 teeth. And you also want to repeat these positions around your maxillary and mandibular arches on both facial and lingual. You can also find a technique for yourself that fits best. I usually would recommend to start on the top, go all the way around, drop down, finish those. Of course, you keep your toothbrush engaged. Then once you're completed with all the outside surface, I'd go ahead and work on the inside surface, just like this. Then I'd come up and continue the inside surfaces just like this, so you can make sure that you've actually completed both upper and lower arches. Then at the end, I would just go ahead and go back and finalize the occlusal surfaces, which is the chewing surface of the teeth. You also want to remember to clean your tongue and position your toothbrush at a right angle with the tip of the toothbrush facing your throat, and just very lightly, not too hard, you want to go ahead and brush your tongue 3 to 4 times to help remove any bacteria that sits there. Next, I will demonstrate the proper way to floss. You begin by measuring an arm length of floss, and when flossing the maxillary, which means the top teeth, you want to go ahead and hold the floss between your thumb and your index finger. So you're flossing in up this way. You have better control. And when you're doing the mandibular arch, you want to go ahead and just use your thumbs like this. So the proper way to wrap the floss around your fingers is by having it wrapped around your dominant hand twice on the middle finger, and then on your non-dominant hand, you do it once. You begin by flossing the distal surface, which is the farthest surface, on the most posterior teeth. So it's this, these are considered the posterior, and you want to begin at the end of the tooth. It can be a little bit challenging. So you want to go ahead and make a C curve with your floss around the tooth. You press the floss firmly against the tooth and move gently beneath the gingival, and you slide the floss up and down. And then when you're moving over to the next tooth, you want to remember to slide the floss to a new and unused portion and repeat this. Slide it in a seesaw, and then you repeat this. slide it in, C shape. Sorry. And you repeat this. And you do the next side. Make sure not to jab out, as you can cause sometimes trauma. You want to just go ahead and slide in and then gently slide back out. It's important to brush for 2 minutes and twice a day and floss once daily so that you can maintain healthy gums and teeth. This completes the tutorial of how to properly brush and floss. I hope you've enjoyed and learned something. Thank you and have a good one.